The biggest lesson learned was the 4-year bicycles that it takes for a health tech SaaS company to work with hospital systems. It's always been to me a perplexing thing.
Hospitals are like, wait a second, what if we created something that caters towards healthcare consumers and patients directly?
And actually get direct access to these patients as opposed to going through the ringer. On-device LLMs, that's all about security and privacy. The American consumer, any consumer, doesn't have interest in having their data be out there in public view for companies to sell to the highest bidder. These are data points that people talk with their loved ones at the dinner table. It's going to kill them one day. We're living in a very cool time, right? What do you mean I don't own my own health data?
Steven, thanks so much for hopping on today's podcast. Really excited to speak to you today, and thanks for making some time.
Thank you, Bert. I'm glad to be here.
Amazing. So for the listeners, we have Steven Rouse, co-founder and head of growth at Savva, joining us. Savva is a medical AI assistant that helps people make sense of their health. So Steven, let's jump right in. You have a very interesting background yourself. You helped build and sell Protocol First, which was one of the first FHIR apps in the marketplace, even before the 21st Century Cures Act was final. What lessons did you learn from that experience that helped shape how you guys are approaching Savva today? That's
an excellent question. Yes. Protocol First was my first foray into life sciences and, e-clinical or clinical trials, health tech, however you want to brand it. I'd say the biggest lesson learned was the 4-year bicycles on average that it takes for a health tech SaaS company to work with hospital systems, right? It's always been to me a perplexing thing where you could go to somebody and, hey, doctor, here's X product and it's amazing. It's going to save time, money, energy, productivity across the board. Mm-hmm. And then a 4-year clock starts right there. Let's get a BAA, a third-party risk assessment, committee approvals, get all that stuff done. And then what happens is you do that, and then a year goes by, and then a physician or a key opinion leader from another committee goes, I didn't approve this, and you start from scratch. Yeah. And Savva is a consumer-facing tool. And you mentioned the 21st Century Cures Act, right? The lesson learned was, man, wouldn't it be great to have a tool where we could, work with these health systems without the regulatory and actually get direct access to these patients, as opposed to going through the ringer, if you will, right, with healthcare.
Right. Interesting. So it's almost like you learn that from these long sales cycles with hospitals, you're like, wait a second. What if we created something that caters towards healthcare consumers and patients directly,
Exactly. And, from my perspective, the 21st Century Cures Act, I think a physician would have certain opinions. I'm not a physician, but in terms of clinical significance and other things, but it allowed us, as long as we don't have a physician login to the EHR and it's patient facing, we can, instead of going to, my favorite doctor at Stanford, Dr. Lacayo, I could go, hey, I already have access to your patient population. There's nothing needed here.
Mm. Yeah. And let's dig into that a little bit, because you guys have reached some impressive numbers already with Savva. I think you had mentioned you guys are going to launch with access to over 298,000 care sites and over 110 EHRs, like the one your physician at Stanford uses. How did you guys unlock that kind of scale from day one?
Great question. The ONC Cures Act mandates that there's 110 electronic health record companies in this country that are mandated by the ONC to have something called FHIR interconnect servers and to give access to third-party apps like us. The problem is, from my perspective, there's not that many people in the world, because FHIR is still relatively pretty new. Right. There's not that many people who are, zeros and ones like my co-founder Amit, that are able to work with this data and scale it in the way that we're able to do. And so, yes, we're launching with 298,000 what we call FHIR endpoints. And so that could be a doctor's office, an urgent care facility, a hospital, and it's all EHR driven, right? And so we started with Epic. That's the number one player, and we've gone all the way down the list over the past year or so in terms of setting up that back end framework.
Yeah, that's pretty amazing. I mean, the amount of folks in the marketplace that don't know that this, CARES Act mandated that these EHR companies give access to third-party apps, and you guys are able to take advantage of this through Savva, right? And like you said, make it easy for your physician at Stanford to get his patients to get connected to Savva, because that connection, that interconnectivity is already there, so it makes a lot of sense. And now going a little deeper on like Savva itself, you've described it as like the first on-device medical LLM. What can Savva actually do, and why was it critical for you guys to keep it off the cloud?
Yes, great question again, Bert. The on-device LLM. Some of the techie people within your listeners, they might be referring that to a mini LLM.
Okay.
Right. It's this whole idea of having it secured on your device as opposed in the cloud, and that's all about security and privacy. We come from the school of thought that the American consumer, or any consumer, doesn't have interest in having their data be out there, in public view for companies to sell to the highest bidder. And
Right.
so, it comes with limitations, right? If you were to ask Savva who the prince of a country is, it's not going to be able to do that because it's not connected to the internet, and so it has limitations. But we've done it because, again, for security and privacy, you and I can talk about 21 CFR Part 11 and HIPAA compliancy and encrypted data and de-identified information, but because this is a consumer facing tool, we feel like the average consumer doesn't have any idea what that means, right? I built this app for my father, really, that kind of population who might be managing heart disease and rocking a Garmin to manage it, and it needs to make sense to someone like that. And so we feel, hey, it's never on the internet. It's not in the cloud. You can be 40,000 feet above the Atlantic Ocean on airplane mode and asking this thing questions, and it's giving you feedback. And we feel, people can wrap their mind around that more so than HIPAA 21, 21 CFR 11. There's not that many people that understand that stuff.
The average consumer won't be as deep into those things, but security and compliance is important for them. Like, not asking them like, hey, what's your social security number when you sign up for Savva, things like that, and
exactly.
And
we don't even have accounts. Since you mentioned that, we don't have an account. We don't ask for your name, your email address, let alone your social security number or proof of ID and all those things. For us, they need to be kept separate.
That's always when you start to raise questions, I think, with consumers. Like, wait, why are they asking me for all this data? Like, where is this data going? And like you said, like, it's building this app for people like your own father, like, that resonates with me, because even my mom the other day was like, hey, my blood pressure is like irregular. I'm like, Mom, get you a device like ASAP, like a Garmin device, but it's like, you still need an app or some layer to track that data, because yeah. So I want to ask you about that. Like, I understand Savva is going to be like integrating different wearables, like devices and apps, even through like Apple Health that's on most of our iPhones. Can you walk us through how users are going to like see everything in one place? Like, what does that UX look like for Savva?
Yes, perfect place to go now. Apple Health is connected to hundreds of wearables, whether it's a glucose monitor, whether it's Garmin or Fitbit or Aura or Whoop, Android Fit and Samsung. Those things connect to Apple Health. When those guys start working together, Apple's kind of one. And so instead of working in the different silos of going to my Garmin and then going to my Whoop and then going to my Peloton or my Strava app or my Fitness Pal, all of those things connect to Apple Health. And so we just from a ease of use perspective, and when you're going through the onboarding, you connect to Apple Health. We educate the user, hey, by the way, make sure your Sleep Number mattress, go into the settings and click the button over to share that with your Apple Health, and then we'll pull that data, as opposed to getting an API to hundreds of different wearables and services. We just go through Apple Health.
Yeah, that makes a lot of sense. I mean, there's I don't even know the number, but I'm sure millions of Apple Health users in the country, right? So making it easy for that population to like connect makes a lot of sense for you guys.
Yeah, totally. And I mean, I just use my use case, right? Like my sauna connects to Apple Health, my Peloton. It's something where I've rocked my Garmin for years. I love my Garmin when I'm out and about doing, hikes and things and mountaineering. And I didn't even know that it connected to Apple Health until we got involved in this business about 18 months ago. And I was like, man, what a cool thing. I could push that data into Apple Health instead of going into Garmin, going to Apple Health,
Right.
going to Oura Ring. I can have all that data in just one place. And that's kind of that, one of the core features of Savva. With, maybe you're not managing a chronic condition. Maybe you're just a biohacker with 10 plus wearables and apps that you're running. So, instead of your morning routine looking through each one, you can see all of that data in one place. That's,
It makes a lot of sense. You guys are basically taking advantage of these connections that are already out there in the market. Like, where do people spend most of their time that are iPhone users? It's, on their phone, right? So if you can make it easy to plug their already existing wearables and devices through an app that's on their phone that they're on hours, at length on a day, like the benefits are incremental from there,
Yeah, I agree.
Yeah. And
sorry. And on the reverse side too, it's actually, go ahead. Go ask your question.
Yeah. Oh no, all good. I was just gonna ask you, maybe on that same point on the reverse side, like not just consumers. I think there's a benefit for, like you said, clinicians and caregivers too, and even maybe the families of the like for you, like if your mother was like using Savva, you may get visibility as a family member, or the clinician when the next time your mom goes and sees her physician, they'll get access to that data, right? So like, what's the bigger vision with Savva, and how do you see it shaping like actual real world care delivery?
Well, that's the holy grail here, right? That's where this space is gonna go. And I think that it goes back to your initial question about ONC Cures Act, right? It's important to note, ONC Cures allows me to connect to every Epic patient in the country, and pull that data out of EHR and give them, access to that information. As soon as I want to push data back into Epic, I need to go on an institution by institution level, get the BAA, get the third party risk assessment, the committee approvals, start the clock. And that's certainly our goal, right? Years from now, I hope we're integrated with hundreds of health systems across the country, where within the patient record right there in the chart in the office, there's Savva vitals or a little area there. But I'm not naive. I know that's going to take a lot of time. Right. So our additional caregiver feature is a workaround and a way that we're going to get there quicker. Not to say we're going to abandon, again, if Mayo Clinic says tomorrow, hey man, let's talk about ways to get this integrated. Of course, we're going to start that clock with them. But for now, I can get, my grandma to download the app on her phone and list me as an additional caregiver, so that I could see, hey, is grandma rocking her Fitbit? Is grandma, walking? How is grandma sleeping? Grandma went to the hospital yesterday. What does the after visit summary mean? And let me ask questions to the after visit summary, and kind of gain insight that way. The same way I can get my physician to be an additional caregiver as well, not going through the official channels, but having an app on the physician's phone where, you can see, hey, is this patient, doing, managing their heart disease and rocking their Garmin and doing it that way. It's worth saying, it's very rough around the edges, right? Right now it's a certified copy. It's too much. What if a physician has 500 patients on it? Very messy, right? And so we've honestly, for the first round of beta, we've left this feature out, but it's close, and we're hoping through the beta, a lot of our physicians that we have on the beta, we're asking them, hey, what do you think this escalation will look like? And it's all of them pretty much have a pretty similar response. A way, and maybe in 5 seconds, to be like, okay, dude is not rocking their device, dude's not sleeping well, not taking their medications. Just a way for a snapshot to be okay, as opposed to seeing a big, long certified copy. And so, this is the holy grail. I think everyone that's getting into this space is going to be, racing to get healthcare involved, to get that escalation in the hands of their primary care provider, whoever it might be. And we just feel like the additional caregiver features kind of like the watered down version of what it will eventually be. But for now, like my wife, we come, my wife manages all my son's healthcare, my healthcare, right? Just a way for her to have all of our data in one place and be able to ask those questions as kind of the head of household as well, not only just to escalate to a physician, but an additional caregiver feature, so that the person in the house, who we find is typically, at least in my house, my wife runs the show over here, and giving her the ability to see my son's information if he gets a lab test. He just got a lab test done last week. He's dealing with an infection, and being able, instead of logging into his My Chart, having that all in one place.
Right. Makes sense. Yeah. No, I mean, it's really interesting with this. You mentioned this beta that you guys have going. Like, is the strategy at the moment, like, is get as many physicians and other businesses, like healthcare providers, to sign up for the beta so that their patients get onboarded? Or is the beta going to be for the consumers and like families like yours? Who do you guys are currently signing up? Like, where are you guys at with that?
Both.
Okay.
All of the above. It's you can't ask a physician to work for free, and I get on these calls, and it's more so, hey, check out the app for yourself from a patient's perspective. Log in to your EHR, see if this is cool. Yes, doctor, eventually I would love for you to bring this up to one of your patients. Our app is free with a $5 premium a year. And so because of that, we really can't afford, and on purpose, to spend $40 per person to get it downloaded, right? To send ads across the internet. We're never going to send a single ad. And so we're taking this very organic approach. $5 a year. Come on, doc. It's not like we're making a ton of money off this patient. We think there's an extreme value add there.
Right.
By the same time, we've been working with cancer coaches and, advocates of, diabetes advocates. And I take calls every day, one-on-one with patients, right? And just trying to bring it at, so maybe a patient will bring it to their doctor or vice versa. We just want to launch this thing from within, healthcare, and within, the key opinion leaders in the space. Could you imagine getting an ad? We see it all the time. We have competitors. Are you managing a chronic disease? Do you want to share your medical records with a?
No.
I just like, it's way too personal, and we're talking about, we have way more empathy. These are data points that people talk with their loved ones at the dinner table. It's going to kill them one day in a lot of cases. Newly diagnosed individuals that are scared out of their mind. This needs to be calm down and very, very, subtle. And that comes with our entire approach to privacy and security. It's all wrapped up there.
Right. Yeah. I love how you guys are catering to both sides of the coin, like the patients and what they need and what they want to see and what they don't want to see. And also the physicians, like in their own like clinical workflow, like what a primary care provider wants to see may be different from like another specialty area, like an endocrinologist or a cardiologist, like they may use similar EHRs, but their workflow setup is a little bit different, so it makes sense that you guys are, and I like that a lot, that you guys are catering to both sides of the equation, because it's important to get both, for long-term adoption. Right. So with that said, you mentioned you're like speaking to different types of groups like cancer coaches and diabetes advocates. Can you tell us a little bit about the traction you're seeing so far, speaking to organizations like that, and what's next for you guys as you scale out Savva and get the beta continuing to roll?
I've found that there's a side of medicine that I'll just admit I wasn't necessarily as aware of maybe 18 months ago when we started this project. The lifestyle medicine folks and the preventative care folks and the value-based care folks, people that believe, or not just believe, are practicing, that you could reverse diabetes with diet, exercise, and sleep. Something where I think 5-10 years ago, that was something where, I don't think medicine was on board with that. It's like, you treat diabetes. And so we've been working with, I think Dr. Padmaja Patel, shout out to you at the American College of Lifestyle Medicine.
Nice.
And American College of Preventative Medicine, American Diabetes Association, American Heart Association. We're planning on, deeply ingraining ourselves with those ones I mentioned and dozens of other nonprofits and patient organizations, as a way to, gain access to their following. But really, I just think we speak to, the
Right.
pillars of lifestyle medicine, the pillars of preventative medicine. And so, we're just going to deeply ingrain ourselves with those people, with those organizations, as opposed to sending ads across the internet, right? Just get access to newsletters, do podcasts, do
Right.
ever to go to conferences, get those folks evangelized
Yeah.
into Savva's mission.
Yeah. In other words, you guys are going to the groups and organizations, like a lot of the associations you mentioned that have um, populations of patients in similar realms, whether it's like, okay, heart disease, diabetes, like these are patients that are all part of that journey. And so going to groups like that, it makes it very intentional, so yeah, makes a lot of sense. And now tell us a little about this beta that you have. I know it's been on the website for a while. I'm signed up. I'm waiting for the wait list. But for anyone that's interested in joining it or learning more, how do they join the beta, and what's the best place to get started?
So the beta, we launched the website in May and started, kind of left stealth mode and started doing calls like this with anyone under the sun who has interest in speaking with me, to be quite frank. The beta is a free beta. It's a way to, we're hoping that the feedback we get, we have about 1,000 people signed up for it now, and a lot of physicians, a lot of key opinion leaders from AI and healthcare and life sciences. And again, a lot of patient advocates and cancer coaches and personal trainers. There's across the board, and it's an inclusive, I think, is the right word. We're hoping that the product, by the time we launch in early 2026, is that my right year? I think so. It's coming up. Crazy to think that this year is almost over.
Right.
By the time we launch, that the product will look and feel, and maybe the brand's identity will have shifted between the time we launch the beta and by the time we launch the product on the app stores.
Right.
So to give, like, not just your feedback and opinion, but what would you change? I don't want to hear, Steve, this is awesome, from everyone. I'm hoping I get a lot of, Steve, why haven't you thought about X, Y, and Z?
Yeah. Get actual feedback from
From
users.
patients, from doctors, from whoever, right?
Right.
We're hoping that the beta, really shifts the direction of the company, and what we're doing. Not too much. I'm like, I think my co-founder like, man, I don't want to rebuild this whole thing. But that's one side. And also, to be frank, it's a launch pad, right? It's, we in order for us to assume that someone's going to willing to make a LinkedIn post or talk to their physician, or physician to talk to their patients, it's like, hey, talk to me, look at the product. Let's get familiar with each other. And, again, have this really organic kind of approach to this, as we're not sending ads, and we want to do this in what we say is the right way.
Right, right. And yeah, I mean, it's incredible the progress you guys are already making. 1,000 people signed up in less than a year. Those are impressive numbers. And hopefully we see you guys not just on the Apple App Store, maybe the Android one day too, because I'm thinking about even my own parents. One is a long-term Android user. The other one is an Apple user, so there's a huge market to cater in both of those. Right.
And
Yeah.
that's, sorry to interrupt you, but that's coming. I think the beta is iOS only,
Mm,
but we will launch this thing in both app stores.
yeah.
Collectively, we'll part of the we're raising money right now, and the first thing we'll do is get a couple Android developers in there, and we've written it in Swift or whatever it is in a
Yeah.
way that can be converted over real quick, and the Android app can come pretty quick after the fact. And so that's definitely part of the plan. And to answer your question, right, the beta is anyone can sign up for the beta. It's actually very cool. Instead of going one by one and sending a LinkedIn message or a TikTok message, whatever it might be, we're starting to see like, oh wow, like 15 people signed up for the beta last night, and we have no idea who they are. They're just coming from wherever, word of
Mm,
mouth and happening organically. This past weekend, we woke up, I think on Monday morning, it was like, man, there's like 50 new signups. And looking at my co-founder, you at a business event? Like,
yeah.
did you get your family in here?
Yeah.
What's going on? And so it's finally starting to kind of gain traction even before we've launched. And so,
That's amazing.
I had
Yeah.
it my way, test flight, caps us at 10,000 users on the beta. And
Mm,
so from my perspective, I hope we have 9,000 extra people on this thing before
right.
we hard launch.
Yeah.
And that's the goal.
You got room. It sounds like from 1,000 to 10,000. So, and
Yes,
I have
sir.
to ask as a marketer. My last question for you is like, what do you think is getting people to join the beta? I know you don't know where they're coming from. Have you asked them like, hey, what made you join like this beta? Like, why are you on it now? Like, have you guys gotten that feedback from the market?
We have, I think it comes from all walks of life, really. I think, I mean, this is a very needed tool. We as American consumers haven't had access to data like this ever. I mean, whether you're a biohacker or you're recently diagnosed with something, I think that immediately see value in something. Wow, like whether you want all your data in one place or you want your information kind of explained to you in plain language, right, from charts and medical jargon into plain language insights that you can actually understand.
Hmm.
Um, it just feels like we're at the kind of the perfect storm of the regulator kind of bringing the ONC Cures and this shift into value-based care and preventative care, and humans being healthier and eating healthier and
Right.
prioritizing exercise, sleep, and nutrition. I just feel like everything's come together all at once, and so it's a million different reasons why people are joining, and it's very interesting to see. Never, very rarely do I get someone to say, "Oh, that's not a good idea." Right? It's more everyone who has kind of concerns. It's all around security and privacy, right?
Right.
Obviously, and that's where we're trying to, we're sticking in that moat. We're trying to be the safest, the most private, secure health tech company that exists. Again, the on-device LLM, and our privacy policy is clear as day. That's what we're trying to do here.
Right, right. No, I love it. I mean, like, I think you guys have timed it super well. This, proliferation of like lifestyle medicine plus this trend of like taking control of your personal health data, like there's no reason why we shouldn't, as consumers and patients, have control over that data, and it not just sit in your physician's office or the EHR. Like, there's things you can do outside of that to, um, you know, not control your health when it needs to be controlled, or just be on top of it, and manage it long term so you live a healthier, longer life. It makes a lot of sense.
I mean, we're living in a very cool time, right? I mean, I think our parents' generation have been, talking about HIPAA and, healthcare, democratization and data ownership for like 30 years. And it's shifted. It's been like, does the insurance company owns your data, the healthcare institution owns your data, the doctor owns your data. Then
Yeah.
it turned into, okay, the patient has like a certified copy, but it's not actually theirs. And then ONC Cures, it's like, no, man, Like this is what do you
Right.
mean? What do you mean? I don't own my own health data, and so it's very cool to see. It's a wild time to be alive. This intersection between technology, AI, what the regulators are allowing us to do.
Yeah.
It's very very cool.
Yeah. Well said. Yeah. I mean, and I stand by my thesis that a lot of innovation I think that happens in U.S. healthcare is always from some regulatory spark, and for you guys, it might have been that ONC Cures Act. So yeah. Without further ado, thanks so much, Stephen, for hopping on the podcast. I really enjoyed our conversation. I'm pumped to keep seeing Savva grow, and who knows, maybe I'll be next in line in your beta to give you feedback from a patient perspective.
Bert, this has been so much fun. I can't wait to do another one of these days, and I wish you all the best in everything you do. And I can't wait. I can't wait to get your opinion and feedback of the beta. Thank you so much.
Appreciate that. Yeah, 2026 product launch can't come sooner. So looking forward to it.
Sweet.